And welcome to the extraoral and intraoral examination. Notice the armamentarium. And now we're revealing the structures of the neck. Very important to be able to visualize everything on the neck. We have the patient lift the chin all the way up. And first we look for the Adam's apple, come down to the cricoid cartilage, and then one step below to the isthmus of the thyroid. Pulling the sternocleidomastoid muscle laterally, we can then palpate the body of the thyroid gland bilaterally. You can also ask the patient to swallow, and the thyroid gland will come up and down with the trachea, looking for any discrete nodules or generalized swellings. Now we're palpating in the anterior triangle, coming up the anterior border of the sternocleidomastoid muscle. Watch the skin moving, the tissue moving under the fingers. Very important to get deep to those deep cervical node areas, all the way up to the insertion. Look behind the ear to make sure there are no lesions behind the ear, and then it's convenient to come down into the posterior triangle of the neck, all the way down into the supraclavicular area. Again, we do it on the other side. We're looking for symmetry, and here we are again, coming up the anterior border of the sternocleidomastoid muscle. Always be looking at the skin as well. Behind the ear. And down in the posterior triangle into the supraclavicular area. Have the patient lean forward. You can palpate the suboccipital areas, and now we're getting ready to palpate the submandibular triangle and the submental triangle. Drop the chin, pull the skin across the inferior border of the mandible on both sides, and you can usually, 9 out of 10 patients, you can capture the superficial submandibular lymph nodes. And the same with the submental nodes. Palpating the lateral pole of the temporomandibular joints, look for range of motion. Should be able to get roughly 3 fingers open. We also look at where the midline is, whether there's any deviation of the midline during opening. We want to get normal translation and rotation. Palpating now the temporalis muscle and the masseter muscles, the muscles of mastication. Here's the anterior temporalis, mid temporalis, and then posterior temporalis. And we want to know whether there's any discomfort in any of these muscles during palpation. Moving into the intraoral exam, visualizing the lips, looking at the vermilion border, any color changes. We pull the lip out and palpate bimanually the labial mucosa to pick up any submucosal changes, and visualizing the mucosal surfaces. Same with the upper lip. Again, inspection and palpation. And then moving to the buccal mucosa, again, every square millimeter needs to be visualized and palpated bimanually. You can also assess the flow through the Stenson's duct orifice from the parotid gland, and palpating the parotid, and you can see that nice drop of clear saliva coming through the parotid duct opening. And we do this bilaterally. Looking at the tongue, let's grab the tongue so that we can visualize the entire tongue surface, the lateral border of the tongue. We also palpate the muscle of the tongue, and we compare right versus left. This is an extremely important area to visualize because it's the highest risk site for oral cancer and precancer. Looking at the ventral surface of the tongue, have the patient open very wide, visualize, and again palpate the ventral surface of the tongue. And moving to the floor of the mouth area, use a mirror to be able to get your access to visualize the posterior aspects of the floor of the mouth. You should be able to see every square millimeter of the mucosa. And then bimanual palpation. This is on the left side, the patient's left side. Get your finger all the way back and be able to push from underneath on the exterior and be able to feel between your two fingers what's going on. And then we're examining the oropharynx. Use the tongue depressor so that you can visualize all of the oropharynx, the anterior and the posterior pillars. And again, you're having the patient say, ah, you can see the elevation of the soft palate. And this is a good test for cranial nerves 9 and 10, the gag reflex and having them say, ah. And palpating the palate, not just a visualization, but also palpation. Sometimes there are subtle submucosal changes. Again, another closer intraoral shot to reveal the structures of the oropharynx. And look at those beautiful palatine tonsils sitting there nestled in the tonsillar fossa. And again, perfect visualization. You can also see the posterior palatal wall. Palpation, if the patient doesn't gag, palpating the base of the tongue area, very important. Here is an example of the brush biopsy technique. You're giving a fair amount of force onto the area and depending upon the lesion, turning the brush on it up to 20 to 30 times if it's a white type lesion. It's just an example of how to do the brush biopsy. And this is using the side of the brush. You can use the side or the end of the brush, and this is just another technique for collecting the cells. And eventually you'll take these cells, you'll plate them onto a glass slide and send them off to the lab. Here is the VisiLight, the oral speculoscopy exam. Trying to illuminate every aspect of the mucosal lining of the mouth. And you're looking for any lesions that show up white. This may well be a helpful adjunct to the screening process.